And then it's also on mental health support, you mentioned.
We have representatives there from Mind in Kingston.
Yeah.
And also from the Samaritans.
Okay.
And they are there every month. And they're for people, they have to approach the Samaritans and Mind rather than them being approached. But we have facilities there for discreet conversations. So people can then take time just to explain what's on their mind if they're having some particular difficulties.
Is there any myths or any barriers that people may have that they not access mental health support?
The shame of actually admitting that you have a problem is a very big issue to a lot of people, and one can understand that, which is why we try, in particular with those services, we've managed to have another bus, as it happens, a smaller minibus that you're able to discreetly go inside and discuss these issues, because we're aware that people are embarrassed perhaps that they're in a financial situation, or maybe they don't want to be seen if there's more of an emotional problem that they want to talk about, and they don't want others to know about this. So we try and respect that and facilitate that by having this bus where someone can go and discreetly go and discuss this.
It is private. Everybody understands how sensitive that conversation can be. And the pressure at the end of the year, costs, everything going up. We've got Christmas, everybody wants to have a time together. So that can bring anxiety, stress, as a consequence, depression. So there are people there that can give support on this. Sometimes we're discussing about mental health. Sometimes we see that people believe that nobody can help them with anxiety. Nobody can help. What are they going to talk to me that's going to help me with my depression? So this is a myth.
And Marcus, I think the thing that's important is the people that appear at our wellbeing days on a monthly basis, they are there in their own offices at any time over the Christmas period and beyond. Every day of the year there's someone that's accessible from the Samaritans and from Mind.
Yeah.
So the listeners to the podcast can, if they feel that need, access these services. It's slightly different, of course, on the Wellbeing Day, where we bring those services, make it that little bit easier, make that connection, that little bit. They can see the person that they're going to talk to, as opposed to an anonymous person, perhaps on a telephone.